Good morning. Hi, I'm Philip Mathew. I'm a fellowship-trained hand and wrist consultant working at Chelsea and Westminster Hospital, which is my NHS practice base at present. I offer private practice consultations at the Wellington Hospital, hand and wrist unit in London, and at Spire Brentwood, and Spire London East, and the Holly Private Hospital. I've been a consultant for 8 years now. So, why did I decide to become a doctor? I was fortunate enough to be able to decide early in my life when I was doing my O-levels that I wanted to become a doctor, and is influenced a lot by family friends who were doctors at that point, and about a book that I read about a paraplegic surgeon, Dr. Mary Werges, who prior to her graduation was involved in a car accident, and about her struggles and determination to make a difference to people. And eventually, she ended up setting up one of the first inpatient physical medicine and rehab units in the country. I was inspired by this and wanted to do my part to help patients, and becoming a doctor seemed the obvious choice. So why hand and wrist as a specialty? It's a great specialty. It's mentally stimulating, it's technically challenging, and one can achieve good results with the right operative or non-operative treatment. Going back, I was inspired reading about Paul Brand, a UK-based hand surgeon who went to India to look at leprosy patients. And using scientific evidence, Dr. Paul Brand was able to show that the disfigurement of leprosy was due to injury, and was due to injury because of a lack of sense of pain. Though I never got to meet him, I did visit the unit that he set up and got to learn about his meticulous documentation about written and photographic evidence of the cases that he dealt with as part of my British Orthopedic Trainees Association fellowship. I then completed fellowships in the US, in Indiana, Barcelona in Spain, and with Professor Mathelin in France, prior to my year-long fellowship at the prestigious Pulvertoft Hand Centre in Derby. I think hand surgery is a very rewarding specialty, and you get to see the effects of your surgery pretty straight away. I was born in India, lived most of my life in Kuwait, where my father worked as an advisor. And then for the later part of my life, for the last 20 years, I've been resident here and working and studying in the UK. So essentially, I have grown up in about 3 countries. I often get asked, what do I find most rewarding about my job? It's very simple: happy patients. I think watching a patient recover function after you've managed their injury or pathology is reward enough. I enjoy guiding them with my knowledge through the decision-making process to choose the right treatment option for them, and then traveling with them on that journey as they go through their surgery, rehabilitation, and a good outcome at the end. So hand surgery in the UK has developed as a subspecialty of both plastic surgery and orthopedics. I've been fortunate during my training to have exposure to both subspecialties, and that has influenced how I manage my hand surgery patients, and I can offer them the best of both worlds. But there are challenges to the specialization, training, and keeping the talent to the specialty. This calls for enhancing our skill levels and undergoing specialist training programs. There are quite a few in this country, and attracting talent into the field, I think, is the need of the day. When people are looking for immediate results and immediate satisfaction, it's important to look at the long-term goals and look at how, as a specialty, we can provide that. Patient-reported outcome measures is a very important concept, and I think as we show that there's a perceivable difference in outcome with patients, it helps us offer better care to our patients. Increasing awareness and improved social media presence through organizations like the British Society for Surgery of the Hand helps prevent injuries, helps awareness to patients and other non-specialists of advancements in our field. Directing future research with collaborations with patients and identifying priorities The BSSH has done this with the James Lind Alliance and priority setting partnerships, which look at what's important to patients, where should we focus our research for the future. And in the same process, standardizing procedures that we do, reducing complications, and driving the whole systems towards what the patient needs is, I think, where our challenges lie. What catchphrases do I use in my work? Well, I think something I keep telling my trainees is listen to the patient and their story, and they will lead you to the diagnosis. It's difficult in today's busy clinics where patients come in, patients go out. It turns into more of a factory system where you're treating patients as commodities. You don't have time to listen to them. I encourage all my trainees to listen to the patient and examine them before ordering any investigations or tests. And 9 out of 10, you won't go wrong.